Hi, I'm Dr. Kodlady Surendra Shetty. I'm the spine surgeon practicing in Spine Care Hospital, West of Court Road, Bangalore. The neck pain usually starts with the degenerated disc disease of the cervical spine. So it may be just a degenerated disc disease or it may be prolapsed disc in the cervical spine. So when it is degenerated disc, when the patient sits for a longer time, like while watching a TV for a longer time or while watching a cinema, what happens? The disc which is degenerated collapses. When the disc collapses, it stretches the outer wall. It stretches the outer wall of the disc where there are pain sensitive fibers. So when the pain sensitive fibers get stretched, the pain starts. So neck pain starts. So this is the common cause of the neck pain. Next, in the neck, there are certain joints called facet joints in the back of the neck. When the disc is weak, disc is degenerated and it is collapsing, so it stresses the joints and gradually joints get worn out. So that we call as a facet joint arthritis. So because of the facet joint arthritis also, the patient can have back pain or neck pain. So sometimes there will be inflammation of these joints because of arthritis, what we call commonly as spondyloarthritis or ankylosing spondylitis. So because of that also the neck pain can start. So these are the common cause of neck pain.